from right here at Mayo, please welcome Johanna, Rian, and Dankbar.
When most of us think about improv, we think about comedy or as a way to have fun. But we feel there's really an application of improv skills to work we do in healthcare to increase that critical moment between our patients and our caregivers and to improve our communication with our peers as well.
Medical improvisation is not about asking our docs to improv their way through surgery. It is about preparing for anything that might and does happen every day in the hospitals and clinics. One physician said, "Improv taught me how to deal with the unpredictable."
There have been a few pioneers in the use of improv in the healthcare and health sciences as well. Both focus on the use of improv as a communication tool. Here's the actor Alan Alda teaching scientists improv skills at the Center for Communicating Science.
And less well-known but rising quickly in the field, Katie Watson is an attorney and actor at Second City in Chicago who teaches improv skills to medical students at Northwestern University.
We've found very few applications of improv in healthcare. One application is with Alzheimer's patients at the University of Wisconsin-Milwaukee with some work done by Dr. Ann Basting.
There are pockets of improv happening all across the country in medical institutions, a kind of a grassroots movement.
But it feels like there's some applicability to the work we do in healthcare. It feels like we're on the cusp of something that could be important to our work. Our friends at the Joint Commission identified communication as one of the chief causes of sentinel events in our healthcare systems.
There are 5 key principles of improv that tie directly to communication skills for healthcare workers. Affirming.
Yes, I understand.
Thinking on our feet.
Quick action we need all the time.
Close listening.
Paying close attention to the work we do there.
Being present.
Focused listening to collect accurate information from our patients and from our peers.
And collaborative problem solving.
It's all about teamwork, folks, all about teamwork. So why are we telling you all about this? Well, you are innovators, designers, thought leaders, and some pretty cool people, actually, who use improv each and every day on every project you have in your organization.
In an improv class, you'll learn basic, applicable skills for use in any work environment, at home or anywhere, because we all improvise every day. Every conversation we have is an improvisation.
As healthcare professionals, we believe there are 2 benefits we see. One with our patients to help their patient experience and to meet them where they are at on their journey in their healthcare journey. 2, with our peers as well. We're all being asked to adapt to change each and every day, and also we're being asked to become more nimble, agile, flexible, and resilient as well. And improv can help in those ways. There are 5, the principles of improv are simple and quite straightforward. Patients are more willing to listen to a doctor who says yes and versus no or yes but.
Yes, and medical students are evaluated on these skills, which improv can help. In another example, a trauma team works together in a tightly choreographed scenario and yet improvs their way through each unique incident. A few more principles of improv include
Accept, never negate your partner.
Teamwork.
Work for the common good.
And commit.
Make bold, active choices and commit to those choices along the way.
Being present and listening deeply means, according to Katie Watson, going beyond words and listening to the full message being sent by the combination of words, tone, facial expression, and body language. One physician said, when you have 12 people trying to take care of a patient at once, it's a challenge to understand what they're all saying. Improv sharpens your listening skills.
For the past year, we've been holding workshops on the Mayo Clinic campus after hours to teach these skills to our fellow employees. They've really enjoyed the experience, but sometimes we take them out of their comfort zone, but they're fine with that.
We've also taught improv to medical students. As one said, what better way to prepare for what might happen in a hospital than by practicing improv? Other students say that improv helps them worry less about making mistakes in other classes.
So Joe, just to reiterate for our audience today, if we say yes and practice this on a daily basis, we'll accept good communication skills from our peers.
Yes, Jean, and they'll also practice effective teamwork by committing to a positive choice to be in the moment together.
So what can you do? Well, practice, practice, practice.
Integrate the principles of improv in daily communications. Take classes at a local improv theater and consider Katie Watson's Train the Trainer course.
And share it back with your leadership as well.
One of our Mayo colleagues has said, improv is about noticing, accepting, and building on each other's ideas with zero time to prepare. It's about doing the best you can with what you have. I can't think of a better skill set to hone in today's climate of constant change.
Thank you.
Thanks.